I'm going to spend a few minutes with you talking a little bit about the stages of Alzheimer, or the stages of dementia, I'm sorry. And before we get there, though, I'd like to ask you a couple questions. How many of you are caregivers, either professional or family caregivers? Great. How many of you are experiencing noticeable memory loss? Liar, liar, your pants are on fire. Everybody that didn't raise your hand. Who in here has ever driven by where you're going? Aha! Revealing. How many of you have lost your keys? Okay. All right. Let's talk about the difference between that and dementia. Most of what we just talked about can be related to a lot of different things. If that is your pattern, if you raised your hand with all the questions about memory loss or a little bit of confusion, how many of you walked into a room and forgot what you were there for? Okay. So here's the difference. That's normal. We're all okay. If you do that a lot, all the time, if that is sort of your pattern, or is beginning to be your pattern, oftentimes we call that MCI, or mild cognitive impairment. Sometimes the doctors will give us that diagnosis. We'll say, oh my God, I think I'm losing my mind, I'm losing my memory. Maybe you just have mild cognitive impairment. Sometimes MCI, mild cognitive impairment, can be a precursor, a predictor to dementia. If you have what's called mild cognitive impairment, and again, it's not just that you misplace your keys from time to time or you have one of those other symptoms. It's if this becomes part of your daily routine, there's still an opportunity to slow that process down. There's a lot of controversy about whether it's useful or not. We're not going to go into talking about medications, but that is an option. There's great research out there that they've done now on what works and what really doesn't work. Not really time with mild cognitive impairment, I don't think, for medication. It's time for you to get up off your bottom and start walking. It's time for you to exercise. It's time for you to be really mindful about your nutrition, what you eat, how often you eat. It's time for you to pay attention to, am I just sitting down and watching TV all day? You need to make social connections. You need to get out there. So what I'm talking about is stimulating all the different parts of your brain that Mary was talking about. It really makes a difference. One of the things that we see often happens with normal maturation or aging is we retire from our jobs. When you're working, your job serves as that kind of a stimulant. So when you retire, there's a challenge before you. How do I want to do my life now? Get busy. Don't just sit. You've earned the opportunity to get up when you feel like it and to go to bed when you feel like it and do what you want to do. But do something on your list. So that goes for all of us in that early phase of beginning to notice some of the changes that occur with aging. Don't let anybody tell you that losing your memory, manifesting these symptoms regularly is a normal part of aging. No, it is not. It's a normal part of aging if you just sit on your bottom and don't do anything. But you can do something with that. So that's mild cognitive impairment. There's one other distinction that we need to be aware of between dementia and some of the other things that are happening that feel similar to what some of the symptoms are that Dr. Flett talked about. And I'm having a moment when I just forgot. Isn't that amazing? So here it comes. And this is what happens. If we breathe, if we take a minute, usually you can retrieve what it is that you've lost. I told the story of not too long ago, I pulled up at the intersection on the plaza, which in terms of where I live, if I go anywhere, I have to pull up to that same intersection, so I'm there all the time. Pause because it's a stop sign, and thought, where am I going? That's scary. That's kind of scary. It took me a deep breath and a pause to go, oh yeah, to the grocery store. It's the same intersection that I go to work, to go visit my family, to go shopping, to go to the grocery store. but I had to take a minute to retrieve that. Those moments are a little bit scary. Those are not diagnostic that you have dementia or that you're getting dementia. So there's another something that happens sometimes when we have an illness, a serious illness. It happens when you have surgery sometimes and undergo a general anesthetic. Not my favorite thing to do now that I'm over 30. Those of you that have had surgery and have had general anesthetic, you know exactly what I'm talking about. As we mature, it's more challenging to get all that anesthesia out of our systems, and it can affect our brain. What happens if you've had surgery, for example, is hopefully they're very mindful about your pain, and you take pain medicine. Sometimes you wake up from general anesthesia, and you don't know who you are and where you are, and you think there might be a fire, and maybe we should call the fire department, or should we call the police, or what should we do, and where's my clothes? No, I don't need clothes anyway. That's called delirium. The difference between dementia and delirium is, for those of us that are sort of lay people, not physicians, if it happens suddenly, if there's a snap, if you have surgery and you wake up from anesthesia and boom, you're disoriented, you have some sort of psychotic symptoms, likely that's delirium. If you have a really bad infection, sometimes we see this with urinary tract infections in us older folks. If you have a fever, you're not well, sometimes you can get what we call delirium. It's a reaction to what's in your body at the moment, and it passes. So it comes suddenly. Dementia sneaks up on us. It's a slower process. Delirium is not slow. It hits and it resolves fairly quickly. If you get off of that medication, or if your fever gets reduced, if you get to feeling better as you're healing, it goes away. So that's the difference between delirium and dementia. Delirium can be really scary because it happens so fast, and typically it's really intense. All of a sudden, I don't recognize who you are when you come in to sit by my bedside. But that will go away. The dementia has a different path. It doesn't go away, it accelerates. So now let's talk about that process of dementia. There, just for simplicity's sake, there's 3 basic stages. Who's got the clicker? Okay. Oh, back. Back. The stages are mild, moderate, and severe. So let's talk about mild. What are some of the things that you might first notice, either in yourself or your person? I'm going to refer to those of us that have signs and symptoms of dementia as, and you're the caregiver for them, as our person. So the person with some early signs of dementia, mild dementia, you might notice initially that that person is having some word-finding problems. Now, we all have word-finding problems, I think, most of us. Every once in a while, it's like, oh, what is that word? I can't remember. And then it comes to you. But this is one of the early signs. Now, I want to caution you, any single one of these symptoms is not diagnostic of mild dementia. What we're looking for is group of symptoms. We're looking for symptoms that actually impact my ability to function as a person with some of these symptoms that get in the way of me being able to really do the things that I normally have been doing in my life. So any one symptom by itself doesn't count. But one thing that we might notice in ourselves or in our person that we're caring for is some mild word-finding problems. One of the things that I often notice when I'm working with someone that has early signs of dementia is when I ask a question of a person, there's this long pause. And I think, oh, maybe they didn't hear me. So I'll ask it again, and sometimes I'll ask it again louder. So it takes a little bit longer to respond if you're experiencing signs of early dementia. Your auditory processing slows down. So if you're the caregiver, it's really important that you give that person some time. We're used to asking a question. How are you doing? Oh, okay, fine. There's not much of a pause there. How are you doing? If I'm a person with early signs of dementia, I have to take a minute to think. So give me that time. Give me that time. And you will have an opportunity this afternoon to talk a little bit about how to, if you are the caregiver, how to sort of manage some of these signs and symptoms with your person. So time is very different for someone that has signs of mild cognitive impairment or mild dementia. So it takes longer to respond. Sometimes it takes a little bit longer to, once the person begins to talk, to really put the sentence together. They can get caught in some word finding in the middle of a sentence. You will notice with mild or signs of mild dementia that decision making becomes problematic. It's hard to do abstract thinking when your mind is starting to kind of parts of your mind are starting to not function as well. So decision making can be very problematic. If you're asking someone with mild dementia to make decisions, make them simple. Make the choice simple. Don't give 3 choices. Don't give 2 choices. Give 1 choice at a time. Do you want hamburger, pork, or ham for dinner? Too much. You want ham for dinner? You want pork for dinner? 1 at a time. One of the ways that we sort of screen for signs of mild dementia, we used to, is we would say, here's a piece of paper, take it in your left hand, fold it in half, and give it back to me. How many commands were in that? Lots. Take this paper in your left hand, fold it in half, and give it back to me. That's 3 commands. Too much. Hold this for me. Okay. Could you fold that in half? And now give it back to me. So that was one of the ways that we figured out early on to see how is the old brain working here. Is that person able to handle complex tasks, complex questions? So keep it simple, give time. You may notice your person, if they're showing signs of mild dementia, the person's beginning to withdraw from conversations. At the dinner table, if there's more than one person there, they begin to get a little bit quieter. It becomes very challenging for a person with mild dementia to process a bunch of different voices all talking at the same time. It's easier just to pull back. So I want to mention one other thing that you see in all 3 stages of dementia, and that is sleep. It's exhausting. It's exhausting to try to get your brain to do something that it's really not able to do anymore. It makes you tired. And a lot of times we see people with mild cognitive dementia nodding off a lot. They're tired. It's okay. Oftentimes we think, oh, I've got to get them up. I have to stimulate them, keep their brain active. At this point, let them rest. It's exhausting. So we're going to see through these 3 stages an increase in sleep. Somebody that maybe never took a nap now is nodding off a little bit or is needing to take a nap in the afternoon for a couple hours. It's all right. They're tired. It's exhausting. You'll begin to see, along with this withdrawing from conversations, and Dr. Flett mentioned this, short-term memory loss. This is probably one of the most noticeable symptoms, and it's something that we're constantly judging ourselves about. What's fascinating is the short-term memory begins to disappear. Long-term memory remains intact. What you did when you went on summer vacation with your 4 kids to the lake, and what the cabin looked like, it's all there. What you just told your person 5 minutes ago about needing to get ready to go to the doctor is gone. Oh, did you tell me that? So this is the time in this phase with mild dementia, this is the time for you guys to be talking to each other about what's going on. A lot of people say, oh, I don't want to talk to my husband, or I don't want to talk to my wife or my dad. I don't want to upset them. Really? Do you think they don't notice that they're not aware? They are. Not aware in the same way you are, but they know something's off. A lot of times someone with mild dementia can say, oh, my memory's shot. your short-term memory's shot, your long-term memory's not shot, and sometimes your remote memory, that memory in between short-term and long-term, is still functioning a little bit. Well, yesterday, we saw Susie on the walk, and she said her husband was in the hospital. Here's what's really, really challenging for both the person with mild dementia in that phase and for you as a caregiver. This kind of memory loss is like Swiss cheese. You know that cheese that has holes in it? Those holes are called never mind. They're like holes. But in between those holes is substance. So at one point in a conversation with someone that has mild dementia, you think, oh my God, they're in there. Everything's okay. That's that substance between the holes. Then you hit a hole and you're like, really? I just answered that question 5 times. That's what's going on. So it's confusing, not just for you if you are the care partner. It's confusing for me as the person. It's like, what is happening in here? I did just ask you that? I had one woman that told me her husband was showing signs of early dementia. She was getting so frustrated because he'd ask a question and she'd tell him the answer and then he'd ask her again. So she fussed at him and said, you know, I just told you that. He said, oh God, I'm sorry. I'm sorry. So then he started asking before every question or every time he wanted to tell her something, did I already tell you this? That preceded every question. So she worked out a system. She taught me this. Every time he'd ask her a question, she'd go. And when he asked her again, she'd go. And when he'd ask her again, she'd go. She thought that was great. What do you think? No. No. What's the best way to deal with that? Answer the question. How much does that hurt you? What we have to remember with this repetitive kind of behavior is your person is not, honest to God, they're not trying to irritate you. That is not their intention. And to be able, as a care provider, to remind ourselves of this, it is a symptom of this disease. The fact that they're asking me a question again. And just answer it. That's all. Much easier for both of you, for the other person. So in this stage of mild dementia, it is the time to talk about it with each other. It helps both of you. You're not sparing your person with early signs of dementia anything. They are aware that something's wrong. Sometimes they're even aware of in what ways is it wrong. Well, I can't remember anything. Or I get confused. So this is the time when it really is a good idea to begin to talk about it. Begin to think about, okay, so maybe we should make an appointment with the doctor. See what's going on. Because sometimes these symptoms can be a result of something else. Like what, for example? Well, anxiety can do this. I don't know if any of you have ever experienced extreme anxiety, but it's really kind of hard to think rationally sometimes, to remember what you're doing. I just had some surgery, and before the surgery, I got really anxious, and I opened my refrigerator, and there was a fork in there. And I live alone, so I couldn't blame anybody. I could give you a big list of some of the really weird things I did. I almost ate dog food. It was in a container. I thought it was turkey burger. So just remember, all kinds of different things can stimulate some of these symptoms besides dementia. Depression can cause some of the same symptoms. Anxiety can. Thyroid disorders can. Medication can. Lack of sleep or extreme fatigue can. Grief can. Not just grief about loss of a loved one. There's all kinds of grief. If you lose your job, if you lose your home, if you lose something that's significant or really important to you, Grief can be very disorienting. So keep in mind that when these symptoms appear, there could be some medical explanations for it other than dementia. Head trauma. Head trauma can really shift your ability to function. Alcoholism. Dr. Flett talked a little bit about how there is some alcohol-based dementia. Well, you can see early signs of that. If we're consuming too much alcohol, it kills brain cells. Might feel nice for a while, but it kills brain cells. So that can be an explanation for some of those symptoms. So it's very scary. If you do get a diagnosis of early signs of dementia, it is time for you to be thinking about, are there lifestyle changes that we need to consider? Are there things that we can do? Do we need to sell our ranch that's out in the middle of nowhere and maybe move closer into support system and resources, or move closer to where family is? Maybe we shouldn't take that cruise this year. So in that phase, it is time to think about, not necessarily time to make major changes, but begin to think about, okay, we need to make some plans here. If I am the care person, I need to figure out at this point, what would happen if something happens to me? If I have to go in the hospital, who's going to be around? Can one of the kids come and stay with Dad for a little bit? What are your options? It's time to begin to think about resources, and do we need to consider any lifestyle changes? This is certainly a time that is frustrating for both you and me if I'm the person with signs of mild dementia. It's a time that's confusing, it's a time that's scary, and it's a time that you talk to each other and that you begin to look at what are our possibilities. The next stage, moderate dementia. Things get a little bit more clear. The word-finding process becomes very obvious and significant. What happens here is the person that has memory loss and that has moderate dementia may begin to use familiar words when they can't find the right word. They'll just plug in a word that they do know what it is. The problem is it doesn't make sense. I have to go home, I forgot to bring my tree. Doesn't make sense. Tree is a word that's familiar. So people with this kind of cognitive impairment will interject words that are familiar to them but don't really fit. The other thing that they will do, which I find fabulous, is they'll make them up. They'll make words up. A lot of times they'll make a word up that is reflective of the function of that word. If I need to water the tree, and I can't remember the word tree, I say, I need to water that big brown thing with bark and leaves. They'll describe something in terms of their function. Or they'll make a word up entirely. If I need to dust the house, I may say, the house is absolutely dustful instead of dusty. So you'll see in terms of communication, verbal communication, some challenges. This is the phase where that repetitive behavior can become really irritating and frustrating if you let it. Lots of repetition. Short-term memory is going, almost gone. And again, remembering that this person is not trying to frustrate you, is not trying to irritate you. It's a symptom. Just answer the question. With mild dementia, we have difficulty completing sentences sometimes. Our thought process gets a little wobbly. We're easily distracted, and you'll be talking this afternoon about some ways that you can actually use that as an asset rather than liability, that easily distracted. But if I have mild dementia and I'm trying to communicate to you, I can lose my train of thought pretty easily, and you might have to bring me back. I might stop and pause. Some of us experience this now. What were we talking about? So that becomes more prevalent in this stage, losing your train of thought. You will see a person in this stage of moderate dementia really beginning to withdraw significantly, socially withdrawing, not liking to be with groups of people with more than one or two people at a time. So this social withdrawal can get very obvious. Getting confused frequently. What was I doing? What was I supposed to do? So this is a time where people also tend to get disoriented. I'm not sure where I am. It's an extreme version of us walking into that room and forgetting what we're doing. Only it's much, much worse. So this is a phase where you need to really evaluate, is it safe for me to drive? Is it safe for me to be left alone? This is a stage where oftentimes everybody gets depressed. Why wouldn't we? If I'm the person with moderate dementia, I am clear that I am not what I used to be. And I have lost my capacity to figure out why and what's happening. It's confusing and it's depressing. And it's depressing for those of you that are caregivers because you are losing your person slowly. It can be excruciating. Their ability to initiate conversations, to maintain focus, to interact with you in any kind of an intellectually challenging way, I'm not hallucinating, there's a fly up here, becomes apparent. And it's, as Dr. Flett was saying, it's sad. So we get depressed as the care provider. I miss him, I miss her. I no longer have somebody to talk about an article in the paper. So we begin to see a significant diminishment in cognitive ability. Everybody notices it. You do, I do. We can't really pinpoint what's wrong. The person with the dementia can't explain to anybody. And again, as in the very first phase, not talking about this is not the answer. You are not sparing me anything. Do I want to know that I have dementia? Ugh. Do you? What does that feel like? It's scary. But avoiding it is not the answer. How you talk about it is the answer. And you're going to have some good opportunities this afternoon to learn a little bit about what are some good ways to talk about that and what doesn't work. A lot of us already know what doesn't work. So other things that you will notice in this phase is that personal hygiene may diminish. Oh, I don't need a shower. I had one last week. I don't want to wash my hair. I don't need to. One of the things we need to pay attention to is now all of a sudden, sometimes shower is scary. It's a little more evident in the next phase, but you can begin to see some of this in this phase. Taking a shower is scary. It's cold, we're naked, we feel vulnerable, it's slippery. If I have dementia, I don't know that's why taking a shower is scary. I just know I don't want to take a shower. I used to spend some time in a board and care facility and work with people that had dementia. And they called me because they had a gentleman one time who'd been in the Navy all of his life. He had mild dementia, probably just moving into severe. He didn't want to take a shower. And he went a month without a shower. And of course, he wouldn't let anybody bathe him. So that was my job as a psychologist, was to go in and talk him into taking a shower. Boy, was that interesting. He couldn't talk to me about why he didn't want to take a shower. But he could talk to me about his life in the Navy and what it was like to be on a ship. So that was my window. I got to ask him, well, do they have bathrooms on a ship? He said, well, of course they do. What do you think we do? Pee over the side? I'm like, no. I said, do they have bathtubs on a ship? He says, no, they just have showers. There's my opportunity. Talking to him about taking a shower on the ship and how did that work. Make a long story short, what I discovered was he didn't want to be naked in this care facility because there's a caregiver there to take care of him. So we let him take a shower with his boxer shorts on, and he was fine. He was fine. You see what I'm saying? You have to figure out some ways rather than having to be right. That's another thing that's tempting for us if we're the care person. We have to be right. Jim, I told you we weren't going to do it that way. Well, no, you didn't. Yes, I did. No, you didn't. Yes, I did. Forget it. Let them be right. Doesn't mean you have to agree. You can just say, okay, and that's the end of it. Even if their perception is different than yours. Does it really, really matter? In AA, they have an expression, would you rather be right or would you rather be comfortable? You choose. If it's a question of safety, you don't always have that option. Yes, you have to wear shoes if you're going to go to the grocery store. No, I don't. Yeah, you do. One round of that, and you have an opportunity to distract, change the subject, do something else. So here's another clue. Fatigue. I know you've all heard the term sundowners. Well, you all sundown. Every single one of you. You sundown. We're tired at the end of the day. We start getting tired at 4 o'clock. You're up, moving around, doing errands, doing all the things that you do about 4 o'clock. I think maybe that's how cocktail hour got started. I'm not sure. We just want to sit down and relax. For someone with dementia, oftentimes, their brain just wants to sit down and relax at about 4 o'clock. So do we. So we all sundown around 4. So just sit down and relax. It's okay. That's not the best time to prepare for a neighborhood barbecue. It's a sit down and be quiet. Decrease stimulation. Maybe just listen to some music with your person. You take yourself off your feet for a little bit. You get to relax too. But again, that 4 o'clock sort of down dip, you have to think about if you're the person with a little bit of memory loss or if you're the care person, this is downtime. This is quiet time. If you try to push through that, what you're going to get is agitation. We see this all the time in skilled nursing facilities. When people sundown, if a care provider doesn't understand what's happening, all of a sudden they say, well, this person really starts to go kind of crazy about 4 o'clock in the afternoon. Well, sure they do. So do you. As a caregiver, you've been on your feet all day. Just accommodate that. As long as that behavior is not unsafe, understand what it is. Oh yeah, we heard about that at that presentation. We need to just kind of calm down, be still for a little while. So in this moderate or mild delirium phase, dementia phase, it is definitely time, if you haven't done it yet, to have an assessment. See your physician, see a neurologist, and have an assessment if you haven't done that yet. It's time. Because the next phase is really, really challenging. Whitney talked a little bit about how you all are a village. For those of you, who is anybody in this room a care person for someone with severe cognitive dementia? Okay, so we've got some people that have lived it and are an expert with this. It's a very, very challenging phase, and it is a phase, you guys, that you can't do by yourself. We wish we could, we want to, but it's something that takes more than one person. So we talked about how in that earlier phase, the mild phase, it begins to get very sad for us if we're the care provider because we're losing our person, we're losing our partner, we're watching them disappear. In this phase, roles change. In this phase, you clearly become the responsible person. Your person that has dementia has lost the capacity to make good decisions. Their judgment is severely impaired. You are now in charge of safety, physical care oftentimes. The person may no longer be able to shower or bathe themselves or wash their hair. Sometimes people in this phase need assistance in dressing. Even the idea of dressing just isn't there. So you may have to help with dressing, with all kinds of personal hygiene. They're no longer safe to participate in the activities that maybe earlier they could. So now, what else has changed? If you're the care provider, your role has changed. You are now responsible at the same time that you're grieving the loss of your person. You are now responsible for everything that they can't do anymore. Now you have to pay the bills. Now you have to do all the cooking and the cleaning and the laundry. You may see continence problems becoming even more evident here. You may see your person with dementia sleeping a lot. I hear a lot in my office, well, she just mostly sleeps all day. It's okay. Sleep is the only place, and we know this, that we can escape all the pressures of being awake. A person that has severe dementia, it's exhausting to make it through the day. Just walking from point A to point B can be a challenge. It's exhausting. Just let me sleep. I don't want to try to sort through all this. I don't want to try to figure this out. I can't. Sometimes I can't even figure out what to do when my body tells me I need to go to the bathroom. So I'll just do it. Because I really can't figure out, well, I need to get up and go into the bathroom. So this is a very challenging stage. You're grieving. You're exhausted. Your roles have changed. You know what burnout is? This really is a common symptom for those of you that are care providers. You just can't stand it anymore because now you can't leave this person alone. And I'm telling you, you can't leave the person alone. Not safe. Remember, judgment is impaired, very confused, frightened, often agitated. You can't leave your person alone, which means, how do you do your life? What do you do when you have to go to the grocery store? What do you do when you have a doctor's appointment? What happens if you break your ankle and you're in the hospital for 2 days? How can you go get your hair cut? How can you get a massage? How can you do the things that are important to keeping you, your mind, your body, and your spirit well and healthy? You need resources, you guys. And that's one of the beautiful things about this gathering today. Talk to each other. What do you do? Who do you use? This is the phase where you probably need to begin to think about getting a caregiver in addition to you that can come in and spell you and give you some support. You've got to begin, because you've forgotten, because you've been so consumed with providing care, you've forgotten or haven't been able to find time, which is understandable, to take care of yourself. And here's the deal. If you're out, if you're down, your person is in deep doo-doo. You have to be number one on your list. You have to take care of yourself. For those of you that are parents, you know this. When you had young kids, if you were sick or not, you just had to get up and do it. And that's what you've been doing, taking care of this person. At this point, that level of care requires support and assistance. This is when we begin to think about, is it safe for me to keep my loved one at home? Do I have the option of having somebody else come in and help me so that I can get out? If you're the caregiver, the care person, this is when it's really important, if you sort of let go of some of your relationships, to begin to recontact people, reconnect. Connection is really important for you because you've lost one of the primary people that you've connected with in your life. So spending time with friends, even if you just go to lunch, if you come over here to the Vintage House and go to a class, whatever feels good to you, go get a massage, go get your hair cut, go play golf with your buddy. It's really an important part of your ability to give appropriate care, that you be able to take care of yourself. I know that sounds weird. I used to talk to the nurses and say, don't come to work and try to take care of me. You're a mess. You need to take care of yourself first. This is totally true. So I'm telling you, whatever you do to take care of yourself is, in fact, a part of you taking care of your person. It's an integral part of your ability to take care of your person if you can take care of yourself. So this is where, if we are a care provider, we get very depressed, we get burned out, we don't know how to get respite. I tell people that I see in my office that are in this position, you have to go away every month. I don't care where you go. Go to Bodega Bay. Go visit your son or your daughter. Every month, you need to find a way to get away. You need respite. If you're not okay, then your other person is okay. So in this stage, things that we notice is there's very little verbal communication. When we get to this stage, we communicate behaviorally. For example, if I have severe dementia and you're trying to help me up the stairs and you come over and take a hold of my arm, I'm not going to say, please don't touch me, let go. I'm going to go. So it becomes more behavioral communication than it is words. This is the stage where folks sort of fail to recognize or forget names. I may see my care provider, who's taken care of me for the last 10 years, come into my room if I have severe dementia, and I don't know who they are, and I don't know their name, but I'm happy to see them. Somehow in here, sensorially, did I make up that word? Oh, okay, sensorially, I feel that you're okay. There's something about your presence. I sense it. This is a good person, and I'm happy to see him. But putting all the other pieces together, who it is, even if it's my partner, my husband, my daughter, my son, I may not get that. So I want to emphasize this. Just because I don't have the verbal capacity, don't think that I'm not there, because I am. Here's something interesting about verbal communication. I find it interesting. They've done some research, and what they tell us now is that 4% of our communication is verbal. 55% is based on our body language and our facial expressions. So when I'm the person that has severe dementia and you walk into my room, I'm checking out, I'm registering your facial expression and your body language. Anybody in here have any deaf, totally deaf family members or friends? Raise your hand if you've ever worked with anybody that's deaf. Okay, well here's something very interesting. If you are totally deaf, I had a gal that I worked with a couple years ago who was totally deaf. I would pass her in the hall, and she lip read and signed, and I'd say, good morning. I'll do it again. Good morning. So finally, and she started missing appointments. And finally, she came in and I said, what's up? Well, you know, why are you not coming back in to see me? And she said, because you're mad at me. I said, how do you know I'm mad? Why do you think I'm mad at you? And she says, every morning when you pass me in the hall, I can tell that you're mad at me. What was missing with my good morning? Yes, just a great big, fat, juicy smile. People that can't hear, or maybe somebody that has severe dementia and can't process what they're hearing, really register your face. I can look out here and tell, and you're not talking to me, I know who's clicking out there and who isn't. I know who's thinking about what time is lunch and what are we going to have for lunch. And who's really zeroing in. It's amazing, you guys, and we're not aware of it, but maybe you will be now, how much we depend on nonverbal communication. 4% is your words. 55% is your facial expression and your body language, and 48% is your volume and your tone. 48% is your volume and your tone. So what difference does it make anyway? Get it? So just, it's tempting when we're irritated when somebody's asked us that same question 10 times to say, I told you that already. Pay attention to your tone and your volume. It's tempting if somebody doesn't understand you. I traveled with somebody with Japan one time, and he spoke no Japanese. And he would go in to buy a donut or something, Japanese donut. And the guy wouldn't, the salesperson wouldn't understand him. So he would just say louder, "I just want one." It's tempting. It's sort of a natural instinct to turn our volume up if we think somebody doesn't understand us. Really not a good thing with somebody that's deaf or somebody that has severe auditory processing problems, which is what we have if we have severe dementia. So this is the phase where, and I want to keep repeating, do not leave your person alone, which means you have to have help. This is the phase where you need to ask the question, what kind of help do I need? Where can I get it? How can I get it? Talk to each other. Talk to each other this afternoon at lunch. Find out. You've got some great resources here. It's never enough, but let's figure out what we have to use and what we don't, where the gaps are, which takes me back to you if you are a care person. Be aware of your strengths. How are we doing on time, madam? Okay. What your strengths are, what you're really good at, and what are your limitations. And don't judge yourself negatively about that. I've got a gal that comes in every time and she says, "Oh, I just hate myself. I just yelled at my husband again." Okay. Be kind, be gentle. This is challenging. This is frustrating. If your partner is 6'1" and needs help in the shower and you're 5 feet tall, you've got a limitation there. If he falls in the shower, you can't pick him up. Figure out what you're good at and what you need help with. Remember that the task is not going to happen if you're not communicating. If you're trying to get someone to do a task, you have to connect with them first. Connection precedes the task. Even if it's we have to get in the car and go to the grocery store, and they're slow, or they don't want to go. Sit down and find a way to connect. Look at them, touch them, slow it down, find a way to distract for a minute. And we'll talk more at length this afternoon about all kinds of ways that you can do that. But if you remember one thing about this, connection is more important than the task. Finding a way to connect. Mary?